Hello and welcome. Today we're speaking to Medical Aid for Palestinians, which is a UK-based charity that delivers locally led medical care and emergency aid to Palestinians in Gaza, in the West Bank, and refugee camps across the region, while advocating for their right to health and agency. With us today at the New Arab Studio, we have Fikr Shalltoot, Gaza's MAP Director, and also Aisha Mansour, MAP's West Bank Director. Fikr, if I can start with you, I have the latest reporting from Palestinian health authorities in Gaza. More than 73,000 Palestinians killed, including over 1,100 since the so-called ceasefire that began last October, and about 1.4 million people, which is about more than 70% of Gaza's population, now need shelter support. What does it actually look like in practice? And how would you describe just how extreme the situation in Gaza is now after more than 2.5 years of genocide?
So, unfortunately, since the start of the genocide, the Israelis started to target the health facilities. And most of the health facilities inside Gaza, talking about the hospitals, primary health care centers, they were directly targeted. Medical personnel in these hospitals, they were arrested, tortured, and some of them, unfortunately, they were killed. Most of the equipment in these hospitals were destroyed. On the top of that, looking at the health facilities that been destroyed, a few of them, and with support from MAP and some other organizations, we can say, they are partially functioning, but still they are lacking the essential medical supplies that need to save the lives of the people who are and still until now, even after the ceasefire, still every day the hospitals in Gaza they receiving the cases that need immediate care and life-saving interventions. However, all the borders is still controlled by the Israelis, and they are not allowing, enough supplies, to come in, and they are preventing the international organizations, to bring in supplies into Gaza, and at the same time not allowing these supplies, to come via the private sector. So even you cannot have access to these supplies in the local market. So you can imagine how the situation is really difficult inside these hospitals. And on the top of that, also, they are not allowing the emergency medical teams into Gaza. So for MAP, for example, the last medical teams was allowed into Gaza was in July 2025. Since then, we were not able to bring any medical teams into Gaza to support the life-saving interventions. So it's been really difficult, and it's really critical, and the size and the number of the people on a daily basis the hospitals have to manage with the limited number of the staff working, and the lack of the resources they need in order to ensure that they are able to provide the services. It making really quite difficult for the international organizations. However, I have to say, that MAP, one of the organizations that we had to change the modality of the work we are doing. So we have to start direct implementation. We have to establish our own clinics in order to meet the need of the population. We have to set up medical points. I mean, in the past, all the medical care used to be provided inside health facilities, talking about hospitals or primary health care centers. But now it's not the case in Gaza. And you are talking about medical points in between the shelters, and to enhance people access into the care. You are talking about like small clinics in different locations, and you have to adapt and ensure that with each displacement happen, because the Israelis continuing, to force people to leave the places where they live. So we have to keep changing the location of our work. So I believe for many times we have to change the locations. One of our key projects, for example, that we used to deliver at the Gaza European Hospital in between Khan Younis and Rafah. And then when the Israelis, expanded and invaded that area, and they forced people to leave, and the hospital itself become under their control, and in the area under their control, and become inaccessible. So unfortunately, we have to suspend services for cancer patients. And it took us a while actually in order to set this project that is quite essential, and it was the only of its kind to serve people in this horrible situation. I mean, talking about cancer patient in particular. So it took us a while until we were able, to find a new location within Nasser Hospital, to resume the services for these patients. And the fact, that the Israel is currently controlling over 70% of Gaza. So this means when we talk about the control, so this means that people in these areas, all of them are displaced, and they push all people to live in just less than 30% of Gaza, which is already, I mean, Gaza, we are talking about only 365 kilometers. I mean, the whole area of Gaza in the past. So now I'm talking about limited, very, very small area. And most of these people, they are displaced, living in tents and really harsh condition now in summer, with the heat, and they are suffering from lack of water, for example. And according to the WASH cluster, that the amount of water they are receiving far below the humanitarian standards of the amount of water that people should have access to. And almost over 80% of the people in these shelters, they are water insecure. And struggling with, of course, infectious diseases, skin and diarrheal infection. And so I mean, health-wise, I mean, when you're looking to look at the situation in general, it's really quite difficult. And what it make it even more difficult, that until now, even after the ceasefire, 9 months since the ceasefire agreement was signed, but until now, the Israelis did not commit to these terms of the agreements, and to allow the essential supplies to come into Gaza, including the very essential medical supplies, which is considered like, talking about life-saving items, talking about emergency medical teams, and talking about fuel and batteries and solar panels, especially. We know that the Israelis cut the electricity from the beginning of the genocide, so hospitals and health facilities depend on the fuel and to run generators and to facilitate the work inside these health facilities and the theaters, for example, in the hospitals. So it's been really difficult, and it will continue, unfortunately, to be difficult without, enhancing the entry of the supplies, and ensure actually free access of the supplies and the emergency medical teams into Gaza.
Right. I think if we can expand a little bit on the extent to which Israeli control of aid and such essential instruments to rebuild Gaza's health infrastructure. What I think one of the most frustrating, and I can imagine for both of you, one of the most frustrating images from the genocide has been the lines and lines of trucks outside Gaza's borders, and all of these medical supplies and key medical aid is there, but it's being blocked from entering Gaza, as you've talked about. So I guess my question is how do you navigate that control, and how do you mitigate those restrictions so that supplies actually do come in and actually do come into the Palestinians?
Yeah, so for MAB, because we are working in partnership with a number of local NGOs and UN and international organizations, and we have really a big team on the ground, 150 staff, including procurement colleagues. So we are, through this partnership, we have managed to get some supplies because some of these partners, they are able to bring some supplies into Gaza. And at the same time, we search in the local market. Whatever we find, we get, actually. Sometimes, even we have to pay more because the items in Gaza are quite scarce. So this is the way we've been trying to manage, but it's not really ideal. And I know that in our clinic, for example, the polyclinic we have in Deir al-Balah, in many occasions we have patients, they come into our clinic and the doctors there, they prescribe the medication. When they go to our pharmacy, they cannot find all the medication they need. And then our colleague, they start to communicate with some other facilities to find out if they have that medication or they have, something in their stock. And sometimes they succeed and sometimes they cannot. And that's why, I mean, when you look into Gaza, yani, and you see the number of the people who are waiting to be referred out of Gaza for a treatment, over 18,000 people are on the waiting list. And basically, not all these people, they have to leave Gaza if there is enough medical supplies inside Gaza, and if there is like free access of the medical teams, to support the local staff and to do their work. So this is the way we've been kind of navigating. But I mean, I cannot say that what we are being able to provide is ideal. It's, I believe, all the work in the health sector and all the sectors. I mean, talking about food, talking about water, talking about, shelter, everything in Gaza is far from ideal.
Of course, and it's not sustainable now, and it's not
Yeah,
sustainable long term, of
yeah.
course. Aisha, if I can turn to you, again, looking at kind of the harrowing, you have the problem of continuing annexation of the West Bank, settler attacks. There's such a combination of issues coming straight from the Israeli government and Israeli policy on the West Bank. Looking at numbers from MAP, 16 Palestinian children killed this year, nearly 200 injured by Israeli forces or settlers, more than 1,500 children displaced by settler attacks, demolitions. From your perspective, how does a combination of kind of this physical violence and displacement have an effect and actually look like for the lives of children and families and everyone living in the West Bank?
Yeah, I mean, you have Palestinians being displaced, or even there's attempts to displace even more Palestinians. I mean, we know what happened over a year ago in the Jenin refugee camp and Tulkarem and Nur Shams refugee camps in Tulkarem, where all those residents were displaced. And you have 40,000+ Palestinians who have been displaced in the north of the West Bank for over a year. But we have the continuous displacement. I mean, there are many communities and a lot around the Ramallah area, Jordan Valley area, who are continuously being displaced. And there's communities that we've served in the past that no longer exist because they've been displaced. And, there's a community called the Mu'arrajat, which is on the way to the Jordan Valley. And we used to serve that community through our mobile clinic every Thursday. Now we pass by that community, which is just vacant, shack type homes, but they've left. And that's because of the continuous harassment, the continuous violence that the various communities face. I mean, we're calling it state-backed violence, settler violence right now. And it's a continuous thing. Every day you will see communities in different villages in different locations being harassed. And with the attempt to displace them, and some communities ultimately leave or go to another area just because it's difficult, the toll it takes on communities. And we talk to the communities we serve in the Jordan Valley. Children are constantly in fear. The settlers come whenever. They take people's goats and sheep, so then you have no way to make a living. And so it's really an attempt to make life so unbearable, so difficult, with the hope from the settlers' side, from the Zionist side, that these people will leave. So it's very difficult. And with that violence, you've got multiple checkpoints, multiple gates. So all of these restrictions on movement, even. Just a few weeks ago, before I started my travel, there was a 4-month baby from the town of Dir Ammar who died at the checkpoint. They refused, he needed medical attention, and they refused to open the checkpoint. So that's the situation of the West Bank. And it doesn't stop. It's a continuous thing. Every time I travel to a different location, I'm like, well, I don't remember that gate there. Every day there's new gates coming up. Every day there's different restrictions, and we're constantly trying to navigate that. And that's difficult when communities are seeking emergency health care.
Absolutely, yeah. And I remember MAP talking about that case, and it's absolutely horrendous. It was the ambulance was subjected to tear gas and stun grenades, and they had to take a detour of 40 kilometers, something like that. And the baby was pronounced dead. It's absolutely horrifying. So how is that, when you have situations like that, how is that reshaping
Yeah.
healthcare and emergency care in the West Bank?
Yeah.
Exactly.
I mean, from the paramedic side, I mean, the paramedics, those emergency responders are being blocked from reaching people who need the care. They're being attacked. Just most recently, we procured bulletproof vests and helmets for ambulance workers. So in what country do you actually have ambulance workers who wear bulletproof helmets and
It's
bulletproof
insane.
vests? Only in Palestine. And we've had to buy that for the Palestine Red Crescent Society so that their first responders can be a little more safe in the situation. But we've also, the health sector, I mean, the main hospitals are in the main cities. You know, it's not in healthcare, you cannot provide cancer care and all these specialized care in every single village and every single town. That's just not possible. It's too expensive. You need major human resources. So these main services are in the hospital. But these days, with all of the closures, to get to hospitals is very difficult. It takes a lot of time. It's very expensive for some communities that don't have access to public transportation. Right now, what we're working with the Ministry of Health and within the communities and within the healthcare system is how do we decentralize? Communities need to have access to emergency healthcare. They're cut off, the gates close, emergencies happen, and how do we make sure that people can get the proper care, at least to keep them alive until they can get to the main hospitals? So we've been supporting over the last years urgent care centers that get set up in various villages. Now they're setting up trauma stabilization points, which are a little less structured than an actual urgent care center. But it's a way for people to get emergency health care when they need it. We've been training doctors and nurses and paramedics all across the West Bank on primary trauma care training so that they are equipped to provide that life-saving care that needs to be done at that point until people can reach, more secondary and tertiary health care in terms of the main cities. And we've been working with communities, too, and doing first aid training. So a lot of the communities we serve in the mobile clinics, a lot of the communities that we've worked with through these urgent care centers and trauma stabilization points, we've been doing first aid training because sometimes not even the healthcare workers can get to these communities. So equipping people with basic first aid response, giving them the first aid kit so that they can serve their communities until they can reach proper healthcare. So it's really about decentralizing and helping communities be a bit more resilient and stronger in the face of these catastrophes that are happening right now.
But it's just absurd that you need to rely on local communities when there is healthcare. It's such an
and it's not
insane.
that. And when you think of the main city having the main hospital, it's really not that far away. I mean, the West Bank is bigger than Gaza, but the whole of Palestine is not a very big country. And to be able to travel from one village to the next town shouldn't really be a big deal. It shouldn't really take that much time. But unfortunately, it takes time. Sometimes it's impossible because everything is closed and they won't open it. And communities are forced to rely on their own resources.
Absolutely. I want to talk a little bit about something that you both mentioned, which is attacks on medical workers in both Gaza and the West Bank. More than 1,700 healthcare workers, 600 aid workers around have been killed in Gaza. Healthcare workers in the West Bank keep getting arrested, targeted as well. This is the deadliest setting for healthcare workers in the Gaza and the West Bank. It's an impossible situation to be working under, I can imagine. You talked about, the MAP talked about the just a couple of days ago, one of the MAPS staff workers was injured in Al Bureij when their house was targeted. You had a couple of weeks ago Hamid Al Wahidi from the Egyptian Relief Committee in Gaza also killed. I can't imagine being a healthcare worker working under those conditions. My question for both of you, when you look at that pattern, do you see this as a systematic targeting of healthcare workers and just a complete disregard by Israeli authorities for the protected status of healthcare and humanitarian workers?
Yeah, absolutely. Actually, we noticed that from the beginning of this genocide in Gaza, when they started targeting the health facilities and, of course, the health personnel inside these health facilities, they've been tortured, humiliated, arrested, and unfortunately, many of them, they were killed. And they continued to do that, actually, during the last 2 years. They never stopped targeting humanitarian workers, not only medical personnel. There are plenty of people working for international or local organizations. Their job is only to support people. They are only humanitarian workers doing their job, and they've been targeted and killed. Many of those working for MSF, for Central World Kitchen, and many other organizations. As you mentioned, Yani, even now after the ceasefire, one of our colleagues who live in his home, actually in Bureij camp, so they sent an evacuation notice actually for the people in the area because they wanted to target a home. His home was not their target, to be honest. So, but the way they are targeting people, so they don't care about the any collateral damage, and his home almost totally destroyed, and he was lightly injured. So this has been happening, and yeah, I believe without accountability, without holding these people accountable, they will continue to do this because there is no enough pressure on them and not to stop. So we have witnessed that, and I know that many of the health personnel, they were under pressure from their families, and not to leave hospitals because all the families, they were really concerned about the safety of their sons or daughters or father, I mean, who are the worker inside hospital, because they know that during this genocide, like, there is no stop, and no one is stopping the Israelis doing anything. So the people are not protected. They are not, they cannot help it. At the same time, they are in this dilemma between their humanitarian work, they have to be in these places, they have to be amongst the community, they have to do this their work, and at the same time, they know that they may be killed, and they can caught in any situation without any protection. This is applicable for my colleagues who are every day now, they are doing their job inside the health facilities or in between the shelters at the medical points, and distributing water, for example, etc. And they know, they cannot guarantee whatever we do for them, and however whatever security measures we put in place. But at the end of the day, the trend and the way the Israelis are targeting people in Gaza, especially those who are supporting, it put them at a great risk. And this is unfortunately will continue without, because they are not held accountable for the work, for these atrocities they are, committing on a daily basis.
Aisha, can I put that question to
Yeah,
you? Is there a chance of accountability?
Well, they've been doing it for years and they haven't been held accountable. And as you said, healthcare workers, healthcare facilities should never be a target. It's against international law. And unfortunately, they do it. And there's many videos. I mean, there's many videos and eyewitnesses of Palestinian healthcare workers, paramedics being targeted, being shot, being arrested, being harassed, injured people being pulled out of ambulances and taken by the occupation forces and arrested. and this is happening all the time, and unfortunately they're not being held accountable, the Israeli occupation. I think that's the problem in Palestine. I mean, it's been happening even before the last this genocide on Gaza, attacks on healthcare workers. I've met paramedics from who in early 2000 were shot and attacked and burned, and so this is not it's not a new phenomenon for the occupation. They've been attacking healthcare workers, but it's become even more. I think when you don't hold an entity accountable, they become more brazen, and they do more, and that's what we're seeing in the West Bank, but of course a lot in Gaza as well.
Absolutely. May I ask one last question before we go? Because I know, and maybe this is more of an abstract question, but you're both working in contexts, as you've both described, that are at breaking points where it's really unsustainable. But international governments are just now overwhelmingly looking away, not holding Israel accountable, and especially with kind of the news cycle moving towards Iran and the wider escalation there, I feel like it's becoming increasingly difficult to put Palestine at the center of attention for governments and media. So my question is for both of you: how is that shift in attention affecting your ability to mobilize resources and operate and support your colleagues in Palestine? And what do you need, or what would you like from policymakers to keep foregrounding despite these kind of changing headlines?
I think there's always going to be other things going on in the world, and they're all very important. But the what's happening in Palestine, it has been a long-term issue, and it needs a solution. And I think one light that I've seen in all of this trauma that we've witnessed over the last few years in Palestine is that there's more awareness amongst the people. I remember a time when I was a kid that nobody ever heard about Palestine. Nobody understood, and they didn't understand what this conflict was about. And I think the education, the knowledge, the awareness has grown tremendously. And that's what keeps me optimistic. I think policymakers will have to follow their public. They'll have to follow their people. And we do, one of the main things that we do is really try to educate people about what's happening in Palestine and why it's happening and what are the issues. And this growing awareness amongst the public, I think, is the key to hopefully mobilizing policymakers to actually be courageous, because I think people know what the solution is and what needs to be done, but it's a matter of being courageous to make that first step. And I think it's just a matter of time, to be honest.
Fikr, any last words?
Yeah, thank you. So, as mentioned by Aisha, I believe the policymakers, they know what they need to do. The whole issue is about Palestine is under occupation. So the permanent solution for everything is just to end this occupation, to lift the blockade that was imposed on Gaza for a very long time, since 2007. So it didn't start in October 2023. Talking about, now we've been talking about just a few things related to enhancing the life of the people. But I mean, we're talking about a whole nation of Palestinian people. They've been deprived, they've been oppressed, they've been struggling and suffering for a very long time. And they deserve to live. That's all. I mean, so policymakers and everywhere, they know what the solution for the whole issue. And I think, as mentioned by Aisha, yani, if they have the courage and they have the will, they know what they should do.
And we can only hope to see that in our lifetime.
I just want to add one thing. Like for us at MAP, our mission is to support the healthcare system, the Palestinian healthcare system. We support the local health system. We support local civil society. Of course, we're also locally led. So all of our offices are employing Palestinians who are leading this with our local partners. And our overall vision is that we want to support this independent healthcare system and support the dignity of health of Palestinians. And I always tell people we're trying to work ourselves out of a job. We don't want this occupation to continue. We want to support building this healthcare system and work ourselves out of a job. We shouldn't need to have humanitarian workers and international organizations working in Palestine. And if we didn't have the occupation, we wouldn't be needed. So this is our ultimate goal of what we do.
Yeah.
Absolutely. And I feel like, especially when you have these such big forums like Trump's Board of Peace, for example, where there is no Palestinian representation, and where I feel as though they talk about the Palestinian problem as a humanitarian catastrophe to be managed, rather than kind of political actors who have a say and who should have a say in their own future. So I think it's really incredible work and very important to put Palestinian agency first in this equation. Thank you both so much for being here. It's been really insightful. I really appreciate it. Thank you both.
Thank you.
Thank you.
Thank you.